Epinephrine Adrenaline. Expanded lecture notes. Epinephrine, also known as adrenaline, is a critical hormone and medication involved in the body's fight-or-flight response. It plays a key role in managing emergencies like severe allergic reactions, anaphylaxis, cardiac arrest, and severe asthma by increasing heart rate, blood pressure, and opening airways. Objectives. 1. To understand the pharmacology of epinephrine. 2. To outline its clinical indications and safe usage. 3. To highlight its role in anesthesia, ICU, and emergency medicine. 4. To review adverse effects, precautions, and monitoring needs. 5. To integrate evidence-based knowledge into practice. Other names. 1. Epinephrine, USAN, IN. 2. Adrenaline, British approved name, BAN. 3. Chemical, 4,1R-1-hydroxy-2-methylamino ethyl benzene 2-diol. Introduction. 1. Epinephrine is the prototype catecholamine and the first-line drug in anaphylaxis and cardiac arrest. Epinephrine is a key hormone in the body's fight-or-flight response, used medically for severe allergic reactions and cardiac emergencies. 2. Research showed its life-saving benefit in acute hypersensitivity and resuscitation. This means studies support epinephrine's effectiveness in treating severe reactions and helping in resuscitation efforts. 3. Studies highlight dose-dependent risks. Excessive epinephrine can worsen myocardial ischemia and cerebral perfusion post-resuscitation. This indicates that too much epinephrine can lead to heart and brain problems after resuscitation. 4. Despite over a century of use, it remains irreplaceable in emergency medicine. Epinephrine continues to be a crucial drug in emergency situations due to its effectiveness. The myths. Myth 1. Epinephrine is only for cardiac arrest. False. Also used in anaphylaxis, asthma, shock, local anesthesia. Myth 2. High doses are always better in cardiac arrest. False. Excess may worsen outcomes. 3. It should be avoided in all hypertensive patients. False. Clinical context matters. Definition. Epinephrine is a sympathomimetic catecholamine that acts on both alpha and beta adrenergic receptors, mediating fight-or-flight responses. Sympathomimetic means it mimics the effects of the sympathetic nervous system, which is responsible for fight-or-flight response. Acts on alpha and beta adrenergic receptors. Epinephrine affects various bodily systems like heart rate, blood vessels, and airways by acting on these receptors. Fight-or-flight responses. These are the body's natural reactions to stress or danger, preparing the body to either fight or flee. History. 1. First isolated by Jokichi Takamine in 1901. This refers to the scientist who initially isolated epinephrine. 2. Commercialized as adrenaline. Epinephrine was marketed under this name for medical use. 3. Became a cornerstone in resuscitation protocols, ACLS, and anesthesia. Epinephrine is a key drug in advanced cardiac life support, ACLS, protocols for treating cardiac arrest and in certain anesthesia situations. Classification. 1. Class. Sympathomimetic catecholamine. Epinephrine mimics the effects of the sympathetic nervous system. 2. Receptor action. Non-selective adrenergic agonist, alpha-1, alpha-2, beta-1, beta-2. Epinephrine acts on these various adrenergic receptors to cause effects like vasoconstriction, increased heart rate, and bronchodilation. 3. Therapeutic class. Vasopressor, bronchodilator, cardiac stimulant, anti-anaphylactic agent. These are the medical uses of epinephrine: to increase blood pressure, open airways, stimulate the heart, and treat severe allergic reactions. Chemical properties. 1. Molecular formula. CHNO. This is the chemical makeup of epinephrine. 2. Molecular weight. 183.2 grams per mole. This is the weight of one molecule of epinephrine. 3. Soluble in water, stable in light and alkaline solutions. Epinephrine dissolves in water but can break down when exposed to light or in solutions that are too alkaline. Physical properties. 1. Colorless to light brown solution, turns pink on oxidation. Epinephrine solutions can change color to pink when they start to break down due to oxidation. 2. Usually supplied as epinephrine hydrochloride or bitartrate. These are common forms in epinephrine as prepared for medical use. Mechanism of action. 1. Alpha-1 stimulation. Vasoconstriction leading to increased BP, reduce mucosal edema. Stimulating alpha-1 receptors causes blood vessels to narrow, vasoconstriction, increasing blood pressure and reducing swelling in mucosal tissue. 2. Alpha-2 stimulation. Inhibits norepinephrine release feedback. Alpha-2 stimulation helps regulate the release of other neurotransmitters like norepinephrine through feedback mechanisms. 3. Beta-1 stimulation. Increase HR, increase contractility, increase cardiac output CO. Stimulating beta-1 receptors increases heart rate, the heart's pumping strength, and cardiac output. 4. Beta-2 stimulation. Bronchodilation, vasodilation in skeletal muscle. Beta-2 stimulant opens up airways, bronchodilation, and can cause blood vessels in skeletal muscle to widen, vasodilation. Pharmacokinetics. 1. Absorption. Poor oral bioavailability, rapid degradation by COMT, MAO. Epinephrine isn't effectively absorbed when taken orally because it's broken down quickly by enzymes like COMT and MAO. 2. Routes. IV, subcutaneous, inhalation, intraosseous, endotracheal, during arrest. These are the ways epinephrine can be administered for medical treatment. 3. Onset. Rapid, seconds, minutes. Epinephrine starts working quickly after administration. 4. Metabolism. Liver, COMT, MAO. Epinephrine is broken down in the liver and by enzymes like COMT and MAO. 5. Elimination. Urine, as metabolites. Epinephrine's breakdown products are mostly excreted in urine. 6. Half-life. Approximately 2 to 3 minutes. This is how long it takes for half of the epinephrine to be removed from the body. Pharmacodynamics. 1. Rapid, potent sympathomimetic effects. Epinephrine has quick and strong effects like those of the sympathetic nervous system, fight or flight. 2. Dose-dependent receptor activity. Low dose leading to beta effects, vasodilation, bronchodilation. At lower doses, epinephrine's effects on beta receptors are more prominent, causing blood vessel widening in some areas and opening airways. 3. High dose leading to alpha effects, vasoconstriction, BP rise. At higher doses, epinephrine's effects on alpha receptors are more prominent, causing blood vessels to narrow and blood pressure to increase. Storage and disposal. 1. Protect from light and air. Epinephrine breaks down when exposed to light or air. 2. Store at 20 to 25 degrees Celsius. This is the recommended temperature range for storing epinephrine. 3. Discard if solution is pink-brown. If the epinephrine solution changes color to pink or brown, it indicates degradation and should not be used. Drug interactions. 1. MAOIs, tricyclic antidepressants leading to hypertensive crisis. Taking these medications with epinephrine can lead to a dangerous increase in blood pressure. 2. Beta blockers leading to unopposed alpha effect, severe hypertension. Using beta blockers with epinephrine can cause severe high blood pressure due to unopposed alpha effects. 3. Halogenated anesthetics leading to risk of arrhythmias. Using epinephrine with certain anesthetics can increase the risk of heart rhythm problems. 4. Cocaine leading to potential toxicity. Using cocaine with epinephrine can increase the risk of toxic effects. Clinical uses. 1. Anaphylaxis first line, IM 0.3–0.5 mg. Epinephrine is the primary treatment for severe allergic reactions. 2. Cardiac arrest IV IO 1 mg every 3 to 5 minutes in ACLS. Epinephrine is used in advanced cardiac life support protocols for cardiac arrest. 3. Asthma exacerbations rare, if resistant to beta-2 agonists. Epinephrine might be used in severe asthma cases not responding to typical treatments. 4. Doc states as vasopressor, adjunct. Epinephrine can be used to help increase blood pressure in certain shock situations. 5. Local anesthesia to prolong duration, reduce bleeding. Epinephrine is sometimes added to local anesthetics to reduce bleeding and make the anesthetic effect last longer. 6. Croup nebulized racemic epinephrine. Epinephrine can be used in nebulized form for treating croup in children. Use in ICU. 1. As vasopressor in septic cardiogenic shock. Epinephrine can be used to help increase blood pressure in these types of shock in the ICU. 2. Inotropic support in post-cardiac surgery. Epinephrine may be used to support heart function after cardiac surgery. 3. Rescue therapy in refractory hypotension. Epinephrine can be used as a rescue treatment for low blood pressure that doesn't respond to other treatments. Use in anesthesia. 1. Added to local anesthetics. Right pointing arrow prolongs effect, reduces bleeding. Epinephrine is often added to local anesthetics to make them last longer and to reduce bleeding in the area. 2. Control of airway edema nebulized. Epinephrine is used in nebulized form to help reduce swelling in the airways. 3. Management of anaphylaxis during anesthesia. Epinephrine is used to treat severe allergic reactions that occur during anesthesia. Use in emergencies. 1. First drug of choice in anaphylaxis. Epinephrine is the primary treatment for severe allergic reactions. 2. Cardiac arrest, essential in ACLS, CPR. Epinephrine is a key drug used in advanced cardiac life support and cardiopulmonary resuscitation. 3. Status asthmaticus, severe refractory cases. Epinephrine might be used in very severe asthma cases that don't respond to other treatments. 4. Upper airway obstruction, laryngeal edema, croup. Epinephrine can treat swelling in the upper airway in emergencies like croup. Nursing management. 1. Ensure correct dose, route, and indication. Nurses need to verify these to administer epinephrine safely. 2. Continuous monitoring. BP, HR, ECG, SPO. Monitoring these vital signs is important when giving epinephrine. 3. Educate patients with severe allergy on epinephrine auto-injector EpiPen. Patients with severe allergies should know how to use an EpiPen for emergency treatment. 4. Document response and side effects. Nurses should record how the patient responds to epinephrine and any side effects that occur. Administration and dosage. 1. Anaphylaxis IM, 0.3–0.5 mg, adults, repeat Q 5 to 15 minutes if needed. This is the typical dose for treating severe allergic reactions. 2. Cardiac arrest IV EO, 1 mg every 3 to 5 minutes. This dose is used in cardiac arrest during resuscitation. 3. Infusion, shock, 1 to 10 mcg per minute, titrated. Epinephrine can be given as a continuous infusion for shock, adjusted based on response. 4. Nebulized croup, 2.25% racemic, diluted. This is how epinephrine is used for treating croup in children. Side effects. 1. Palpitations, tremor, anxiety, headache, sweating. These are common side effects due to epinephrine's stimulant effects. 2. Hypertension, tachycardia. Epinephrine can cause increased blood pressure and heart rate. 3. Nausea, vomiting, Some people may experience these gastrointestinal side effects with epinephrine. Serious side effects. 1. Severe hypertension. High doses of epinephrine can cause dangerously high blood pressure. 2. Arrhythmias. Epinephrine can lead to abnormal heart rhythms. 3. Myocardial ischemia. Epinephrine can potentially cause reduced blood flow to heart muscle. 4. Pulmonary edema. In some cases, epinephrine can lead to fluid buildup in the lungs. 5. Cerebral hemorrhage. Very high blood pressure from epinephrine can increase the risk of bleeding in the brain. Contraindications. 1. None in life-threatening emergencies. In critical situations like anaphylaxis or cardiac arrest, epinephrine is used regardless of other conditions. 2. Relative. Severe hypertension, ischemic heart disease, hyperthyroidism. In non-life-threatening situations, caution is advised with epinephrine use in these conditions due to potential risks. Precautions. 1. Use caution with elderly, hypertensive, or cardiac patients. Epinephrine can increase risks in these groups due to its effects on the heart and blood pressure. 2. Correct hypovolemia before vasopressor use. In cases of low blood volume, again this issue is important before relying on epinephrine to increase blood pressure. Advantages. 1. Life-saving in anaphylaxis and cardiac arrest. Epinephrine is critical in treating these life-threatening conditions. 2. Rapid onset, short half-life, easily titratable. Epinephrine acts quickly and has a short duration, making it easy to adjust dosing. 3. Multiple routes of administration. Epinephrine can be given through various routes, IM, IV, EO, nebulized, making it versatile in different situations. Disadvantages. 1. Short duration. Epinephrine's effects don't last long, which might require repeated doses or alternative treatments. 2. High risk of arrhythmias and myocardial stress. Using epinephrine can increase the risk of heart rhythm problems and stress on the heart. 3. Not suitable for long-term use. Due to risks and side effects, epinephrine isn't typically used for prolonged treatment. Clinical considerations. 1. Always use IM route for anaphylaxis, faster and safer than SC. Intramuscular injection is preferred for treating anaphylaxis. 2. Continuous monitoring required in IV use. When giving epinephrine intravenously, close monitoring of the patient is needed. 3. EpiPen education is essential for allergy-prone patients. Patients at risk for severe allergic reactions should know how to use an EpiPen. Comparison with other agents. Feature, effect comparisons. 1. Epinephrine. Main receptor action. Alpha-1, beta-1, beta-2, mixed strong effects, vasoconstriction. Moderate to strong, via alpha-1, cardiac stimulation, beta-1, strong increase in HR and contractility. Bronchodilation, beta-2, yes. Useful in anaphylaxis, asthma, arrhythmogenic risk. High tachyarrhythmias common, preferred clinical use. Anaphylaxis, cardiac arrest, severe asthma, respiratory shock. 2. Norepinephrine. Main receptor action. Strong alpha-1, some beta-1, minimal beta-2 vasoconstriction. Very strong dominant effect cardiac stimulation, beta-1, moderate increase in contractility, mild AR effects, bronchodilation, beta-2 number. Arrhythmogenic risk. Lower than epinephrine, preferred clinical use. Septic shock, first line, profound vasodilatory shock. 3. Dopamine. Main receptor action. Dose dependent, low equals dopamine receptors, moderate equals beta-1, high equals pure alpha-1, vasoconstriction, high dose equals strong. Cardiac stimulation, beta-1, moderate increase in HR and contractility, bronchodilation, beta-2 number. Arrhythmogenic risk. Moderate dose related, preferred clinical use. Cardiogenic shock. Renal perfusion, low dose use limited today. 4. Phenylephrine. Main receptor action. Very strong alpha-1, pure alpha, vasoconstriction. Very strong. Cardiac stimulation beta-1, minimal, reflex bradycardia possible, bronchodilation beta-2, number. Arrhythmogenic risk. Very low. Preferred clinical use. Hypotension with tachycardia, epidural-induced hypotension. Additional information. 1. WHO Essential Medicines List. Epinephrine is included on this list of important medications. 2. Used in both human and veterinary medicine. Epinephrine has applications in treating conditions in both humans and animals. 3. Auto-injectors, EpiPen, Jext, are standard in allergic patients. These devices are commonly used by people with severe allergies for emergency treatment. Current trends and research studies on epinephrine. 1. Timing of epinephrine in cardiac arrest. Early administration of epinephrine in cardiac arrest is associated with improved outcomes, including higher return of spontaneous circulation, ROSC, and better functional outcomes in pediatric infantile cardiac arrest. Each minute delay in epinephrine administration was associated with decreased survival in out-of-hospital cardiac arrests with non-shockable initial rhythms. 2. Investigations into low-dose continuous infusion in sepsis. While the search didn't yield specific studies low-dose continuous infusion of epinephrine in sepsis, epinephrine is used in shock states like septic shock as a vasopressor to help increase blood pressure. 3. Research into alternatives and adjuncts to reduce side effects. Researchers are evaluating the impact of epinephrine administration intervals on resuscitation outcomes in adult cardiac arrest. Studies suggest that the current recommendation of administering epinephrine every 3 to 5 minutes is based on expert opinion, and there's ongoing investigation into optimal timing and dosing to balance benefits and minimize side effects like arrhythmias and myocardial stress. Patient education. 1. Teach proper use of EpiPen for self-administration. Patients with severe allergies need to know how to correctly use an EpiPen in an emergency. 2. Importance of early use in anaphylaxis. Using epinephrine early in a severe allergic reaction can be life-saving. 3. Stress need for emergency follow-up after use. After using an EpiPen, patients should get immediate medical attention to ensure proper care and monitoring. Conclusion. 1. Epinephrine remains a cornerstone of emergency medicine and anesthesia. It's a critical drug in treating severe conditions like anaphylaxis and cardiac arrest. 2. Despite risks, its benefits far outweigh disadvantages in life-threatening events. In emergencies like anaphylaxis, the benefits of epinephrine use outweigh the potential risks. 3. Requires careful dosing, monitoring, and patient education. To use epinephrine safely and effectively, proper dosing, monitoring of the patient, and educating patients and applicable are important. Take-home tips. 1. First line in anaphylaxis and cardiac arrest. Epinephrine is the primary treatment for these life-threatening conditions. 2. Route matters. IM for anaphylaxis, IV for arrest. Using the right route of administration is important for effective treatment. 3. Always monitor patient closely. Monitoring the patient is crucial when giving epinephrine due to its potent effects. 4. Educate patients at risk on auto-injectors. Patients with severe allergies should know how to use epinephrine auto-injectors like EpiPen. Professional quote. Epinephrine is not just a drug, it is a lifeline that turns seconds into survival. This quote highlights the critical role epinephrine plays in emergency medicine, particularly in life-threatening situations like anaphylaxis and cardiac arrest. Epinephrine's rapid act can make the difference between life and death in these scenarios. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.